Hi doctors, welcome to the new episode of our A to Z series where every day alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode O where O stands for ovulation. So let's begin with the first question. After 18 hours of which peak in the provided image is associated with the occurrence of ovulation? Option A 1, option B 2, option C 3 and option D 4. So which option do you think is the correct one? Yes, option B 2 is the correct answer. So here is the graphical representation of different hormone levels in different phases of menstrual cycle. The process of ovulation begins when the hypothalamus releases gonadotropin releasing hormone. GnRH causes the pituitary gland to secrete follicle stimulating hormone and luteinizing hormone. The ovulatory phase begins with a surge in luteinizing hormone and follicle stimulating hormone. Luteinizing hormone stimulates egg release, that is called ovulation, which usually occurs 16 to 32 hours after the surge begins. So let's have the next question. What is the appropriate evaluation for a 30-year-old woman who visits an infertility clinic and has a consistent 28-day menstrual cycle? Option A, serum progesterone on 14. Option B, serum progesterone on day 21. Option C, serum LH on day 10. Option D, serum LH on day 21. Well, yes, the correct answer is option B, serum progesterone on day 21. Serum progesterone on day 21. In a woman with a regular 28-day cycle, the evaluation of ovulation can be done by measuring serum progesterone levels on day 21 of the menstrual cycle. Day 21 corresponds to the luteal phase of the menstrual cycle when progesterone levels should be elevated if ovulation has occurred. So now let's talk about the ovulation tests one must remember. Basal body temperature more than 0.5 degrees Fahrenheit, serum progesterone more than 3 Ng per ml on day 21 is retrospectively suggestive of ovulation. LH more than 15 IU, serial USG, direct evidence is by laparoscopy a yellow puncta on ovary is suggestive of ovulation. Cervical mucus studies, premenstrual endometrial biopsy and middle smudge, that is mid-cycle pain. Let's move ahead to the last question of the day. Which hormone acts on the endometrium after ovulation? Option A, luteinizing hormone. Option B, follicular stimulating hormone. Option C, progesterone. And option D, estrogen. Well, yes, the correct answer is option C, progesterone. After ovulation, the ruptured follicle transforms into a structure called the corpus luteum. The corpus luteum produces progesterone, which is the hormone primarily responsible for preparing and maintaining the endometrium. Progesterone helps to thicken the endometrium, increase its blood supply, and create a favorable environment for implantation. So at last, let's discuss about the phases of menstrual cycle and corresponding hormone levels. Menstrual phase, which lasts from 3rd to 7th day, low levels of estrogen and progesterone. Follicular phase, from 10th to 14th day, estrogen gradually increases, FSH increases, LH increases slightly near ovulation, progesterone remains low. Ovulation day, 14th of a 28-day menstrual cycle, LH surges, causes ovulation, estrogen reaches its peak, FSH decreases, progesterone starts to increase. Luteal phase, lasts 12th to 14th day before menstruation. Progesterone continues to increase, estrogen starts to decline, LH decreases after ovulation and FSH remains low. So that's all for today. Thanks for watching and see you in our next episode, which is going to be episode P.